Okay.
So now we have the heart, and we've cut it basically just down the center. And you sort of want to lift up the hood here, if you want to call it that. And what you can see now are various chambers of the heart. And what you see here is, this is the septum down the center of the heart. This is the right ventricle, and we'll try to open up the right atrium in a bit. But this is the left ventricle, and you can always recognize the left ventricle, not only because anatomically, do you mind lifting the hood up on that? There you go. Perfect. So you're sort of looking now at these two in comparison. This here obviously can be opened up a little bit more, and we can shave that back a little bit further here in a minute. But basically, this is the right ventricle, which is the right ventricle here. And this is the left ventricle, and this is the left ventricle here. And what you can appreciate is how thick this muscle is right here, and how this chamber is squeezed down a little bit. But this muscle in this cow is very, very thick, because this is the chamber that has to squeeze down with enough force to squeeze that blood past this mitral valve and out through this aorta, which is the same as pushing it out through there. This valve here, this is the mitral valve right here. So that is this valve right here. And you can see these little areas here. These are called chordae tendineae. And that's what holds these valve leaflets. So when you look at a valve, any one of these valves, you sort of think of two French doors. They're supposed to open and close, open and close. And some people have a problem where the valve won't open, so that means it's stenotic, it doesn't open very well. And other people have the problem where the valve doesn't close correctly, so it's regurgitant, it's insufficient, it doesn't close. So instead of closing the way two French doors do, where they coapt together in the middle, the ones that are insufficient or regurgitating, they're closing like two saloon doors and they're going backwards. The things that keep it from closing backwards is what we call a coaptation plane, because these leaflets overlap a little bit and they come together in the center, and that keeps them from going backwards. And then they also have these parachute cords, and that's what these chordae tendineae are. And these keep those leaflets from going backwards too far. And so sometimes at surgery, we have to go in because somebody's ruptured one of these. They've had a heart attack, and one of these cords, which goes into the muscle here, ruptures, and then these leaflets go backwards. And so we can actually go in and identify which ones are broken, and then we can actually replace them with Gore-Tex, things made of Gore-Tex, the same things that your coats are made out of. And they actually make sutures, and we sew that into the muscle here and replace it by sewing it and just getting the right length, the perfect length on it, so that they don't go backwards. And so this is the mitral valve. This is a valve that is frequently in trouble and that we have to repair and replace. And then the aortic valve was cut basically through with this incision actually here. So we actually have the aortic valve right here as part of it. But the aortic valve comes right through here, and here is the remnants of part of that valve as we come up through here. But yeah, sort of in here. So we've got the aortic valve here, and this is again, the left ventricle. This is the right ventricle, and here's the left atrium up here. So as I said earlier, when the blood comes out of the lungs, it comes into the left atrium. And I should be able to find that hole. Yeah, so you can bring my finger. That's the hole where the blood is coming from the lungs into that chamber. So my finger can come right through that hole, which is in the back of the heart, and it comes right into that chamber. And so then the one from the other side is also here, and I can put my finger through those holes and get into the back. And those correspond to this hole.
This one?
Yeah, so I got my finger through this hole right now in the back of the heart, and it's like you can put that straw through there, and you can see how it would come out. Turn that around. See how it comes through, and turn that whole heart model around for them. So that's how my finger is coming through, just like that straw would come through right now. I've got my finger in the back of that hole, and then this hole right here if I put my finger through that hole in the back, you can actually see my finger come through there right now. So when we talked about this vessel here, this is the anterior descending vessel. And as I said before, it lies right over the interventricular septum. And this is an important part of the muscle. And this vessel lies over it, and it gives off all of what we call perforating vessels that go down and supply blood to this part of the heart. So even though it sits on top of the heart, it's giving off all these branches as it goes along. So we frequently have to fix that and bypass that blood vessel. And by doing that, we not only improve the blood supply to this part of the heart, but also to this deeper part of the heart. Now when we look over here, this is where we get into the right ventricle, and we just need to make those, you see these scissors right here? You can just take off a little more of that edge there so you can see it a little bit better. And you can start to see into the right ventricle. And what you're also seeing is here's the tricuspid valve down in here. There's the remnants, and there's the little chordal structures to the right. This is the tricuspid valve, right ventricle. We have our finger in the right ventricle, and here's the tricuspid valve, and here's the tricuspid valve up in here, right here. And if we take off this, if we take off that little atrial appendage, we should be able to see right into that chamber. So now I can put my finger right through into that chamber. This is the right atrium right here. This is, I'm in my finger in this chamber by cutting off that ear of tissue on the outside, that right auricle, going right in there.
Are you going through the valve?
Yeah. And I'm going right through the valve right now.
So
now,
like what my finger's doing.
Exactly. Now, remember before we showed here's the superior vein, and it drains in there as well. So I can put my finger right through that superior vein, and here's the right atrium, and it will also come out through that ventricle right here, because this is this same vessel. It's cut off right here. I'm just putting my finger through there into there. Remember I had the straw through there a minute ago? And then I also had the straw through the inferior vena cava, which is on the bottom. And if I put my finger through there, I don't know if it's long enough, but then you should be able to see my finger there too. I don't know if you can see it.
I can see it.
Okay,
Yeah.
come through there. And that's because it's coming from that inferior vena cava into that chamber right there. So it all sort of ends up making sense in the long run. But again, probably the important points are that look at this, it's made almost entirely of muscle. There's some fat around it, but it is made almost entirely of muscle. Those arteries that we talked about on the front of the heart, let's do something here and let's see what those arteries look like when you cut them in half.
Cross-section of it.
Yeah, get a cross-section of those important arteries that I said run right through the front, and it's a little hard to see, but you can see one of them right there. It's sort of deep. It's where's that little poker that we had, that tiny, yeah. You can see one of them right there. So there's one of those vessels. And then the other vessel, there may be another one in here, but this is one of those septal vessels that's going right down into this muscle right here. And it runs straight across. Now, what's interesting here too, if you look at these veins, and if you lift this up, that blue vein right there, that is also being drained back. But here is that artery, that big artery, that big red artery that is running. Let's see, put that back on there for just a second. So that big red artery right here in the fat, there it is right there. There's that big red artery. It's just cut right here long ways. And so that artery, and as I said before, if we wanted to get to it at heart surgery, the way we would get to it is we would actually cut it. We would get to it this way. This is the 10 blade, right? Yeah. So if we were going to get to it surgically, we would actually get to it by making an incision right through here. And that's how we would get to that vessel and open it up. It's hard to get it to open up here, but we're in the inside of that vessel right there now. And that's how we would get to it. Let me try to get that opened up a little bit better.
I can see
So
it pretty
here
good
it is,
in there,
it's right
actually.
here. So this is that vessel and we're right inside of it. And the way we'd get to that in our human heart, we would just very carefully with tiny knives, much smaller than these, and we just slowly scrape across the top of that fat until we see the vessel, and then we make a small hole in it, and we have these tiny, tiny, tiny little scissors, and we can just open this up about 4 or 5 millimeters, and then we sew the bypass conduit, which can either be vein from your leg or an artery off your chest wall, and we sew that onto there, and then that creates a bypass graft into there. So that's what those vessels look like. And those are the coronary arteries that frequently can get clogged up in people's hearts that we have to fix. The valves that we're looking at here, these valves, as I mentioned earlier, not only are they repairable sometimes, but we can also replace them. We can cut those valves out and replace them with a man-made valve if we need to. Now, the one other thing I want you to appreciate is that this is the mitral valve right here, and this is the aortic valve right here. And they are literally millimeters apart. So this valve up here that's sitting up there and here actually runs right on the border of this valve in here. It doesn't look that way, but that's the three-dimensional part. So if you're repairing or working on this valve and you take too big of a stitch, all of a sudden now you're into another valve and you can get into trouble pretty fast. So now I wanted to see if I could also see that fossa ovalis that we were talking about earlier. Oh, yeah. And we're going to see if we can just open this up. Let's see if we can get that. There's the valve very nicely. Now let's see if we can get, we're going to cut through the tricuspid valve, which is, you can see the leaflets right there. Cutting through those leaflets right now. There, now you can actually see, here's the atrium right here. And you can see there's that right atrium. And then here's where the tricuspid valve is, and here's the right ventricle. So we're going to take that off of there again and make the comparisons side by side. So I will just lay it out just like it is there. So here is, now this is the right atrium, and here is the right atrium here. And then here is that valve, which is in white right there. And then you can see this ventricle, which is just like this. And see how rough it is on the inside? Yeah. It's just like that. So they're really identical specimens. And I'm going to see if we can find the coronary sinus, which I think is usually, yeah, it's right there. But I want to see if I can find that fossa ovalis. And we will see. Yeah, I think it's right up now. So this fossa ovalis is sitting right in here. And that's the old area that used to be open and wide open, so that when blood actually ended up coming back to the heart, it came up. Get that direction again. It came up here where my finger is going through, and it came up and it went right through that hole, which is a little bit hard to actually appreciate, but I want you to see that right in here is where this fossa ovalis is, and sometimes that hole, there's still a residual hole in there, and then we can actually put a stitch in there and fix that, which is right down in there. So
after you're born, the hole in the heart doesn't close, essentially.
yeah, sometimes it doesn't. And most
say they
people
have
it closes.
a hole in the heart. That's often what they're referencing.
Yes, in adults it is. When they're talking about in kids, it's a hole that is between these chambers right here. So that's called a ventricular septal defect, and that's a bigger deal that usually and frequently can require surgery when you're a child. But most of the time, when you're born with those holes, they close up on their own. So occasionally they require surgery. The other holes we'll usually fix if we're there, and they still have them as adults, we'll go ahead and fix them. Not usually standalone, meaning if that's the only problem, we don't usually need to fix them. But if you're in there for something else, to get a valve taken care of, coronary arteries, then we'll fix it while we're in there. So, but this is sort of a nice view then of the heart. This is really very comparable to what you're seeing here. And again, just to run through, here is your right atrium, tricuspid valve, right ventricle, and then the blood is actually coming up through here and out through the pulmonary valve, as you can see my finger coming through there. And then when the blood gets ejected, it's coming out because my finger is in this vessel right here, which is going down there. So then the blood comes through there, goes into the lungs. It comes out of the lungs and it goes back to these chambers, comes out of the lungs, and then it goes over here to, let me get this, to this left atrium here out of the lungs. And so this is the left atrium of the heart. Here's the mitral valve. So this is the left atrium. The blood's coming out of there where my finger is. Here's the mitral valve, the third valve in the system. Here's the mitral valve right here. And here are those chordal parachute cord structures I talked about. And then this chamber squeezes the blood, and the blood comes out here through the aortic valve, which is right up here at the base of that. And that's the aortic valve. And then it makes full circle up through the aorta. So,
Awesome.
yeah. So that's pretty much it for a basic anatomy course or demonstration. And all of these valves are approachable. We repair them or we replace them. Sometimes people's aortas rupture, and then if you can show that, we replace it with that kind of Dacron material. If the aorta ruptures, we can cut this out and replace it with that. Exactly. Just replace the whole aorta with that. We can cut the valves out and replace those. So there's a lot of different things that we can actually do to work on the heart. And we could have another discussion someday about how we can stop the heart and keep the heart still for a bit so we can work on it and open it up. But
Thank you
there
so
we go.
much.
Sure, by all means. Thank you.
Awesome.
How much time are we?